8 symptoms of liver cancer that will shock you. Liver cancer is one of the fastest rising causes of cancer-related death worldwide, yet most people never see it coming until it is too late. What makes this even more surprising is that it often receives far less attention than many other cancers, despite being just as deadly. Many people live for months, even years, without realizing their body is already showing early warning signs. That is because liver cancer can develop silently without causing obvious pain or dramatic symptoms in its early stages. Now imagine this for a moment. By the time you finish watching this video, you may begin to recognize warning signals that millions of people overlook every single day. Before we begin, I'm curious, where are you watching from right now and how old are you? Let me know in the comments below. In this video, we will walk through 8 subtle but powerful symptoms of liver cancer that could help you notice something important before it is too late. Sign number 1. Unexplained fatigue and weakness. One of the earliest and most overlooked symptoms of liver cancer is a persistent feeling of fatigue that seems unusual. This type of exhaustion often does not improve, even after a full night of rest or reduced activity. Many people describe it as a deep, lingering tiredness that affects both physical strength and mental clarity. This happens because the liver plays a critical role in metabolism and energy production within the body. When liver function becomes impaired, toxins can begin to accumulate in the bloodstream instead of being properly filtered out. As these toxins build up, they can interfere with normal cellular function, leading to a constant feeling of weakness. Unfortunately, many individuals assume this symptom is simply due to stress, aging, or a busy lifestyle. However, when fatigue persists for weeks without a clear explanation, it may be a signal that requires medical attention. And as the body begins to show more noticeable changes, the next symptom may become even harder to ignore. Sign number 2, loss of appetite. Another early warning sign of liver cancer is a noticeable decline in appetite that develops gradually over time. Foods you once enjoyed may suddenly seem unappealing, even when you have not changed your diet or routine. Some individuals also notice that they feel full much faster than usual, even after eating small portions. This change can occur because the liver plays an important role in regulating hormones that influence hunger and digestion. When liver function becomes impaired, toxin levels can rise and disrupt the body's normal appetite signals. Many people describe a persistent sense of discomfort or disinterest in food that lingers throughout the day. Unfortunately, this symptom is often mistaken for common digestive issues, stress, or temporary stomach problems. However, when reduced appetite continues for weeks, it can lead to gradual weight loss and nutritional imbalance. And as these internal changes progress, another subtle but important symptom may begin to appear. Sign number 3, unintentional weight loss. Another warning sign that often goes unnoticed is losing weight without making any changes to your diet or lifestyle. You may find that your clothes feel looser, even though your eating habits and physical activity remain the same. This happens because cancer cells consume large amounts of energy as they grow and multiply within the body. At the same time, impaired liver function can reduce the body's ability to properly process and absorb nutrients. As a result, the body begins to lose weight gradually, even when food intake appears normal. Many people initially overlook this change, assuming it is simply due to stress, aging, or minor lifestyle fluctuations. However, unexplained weight loss can be a serious signal that something deeper is affecting the body's metabolism. If this pattern continues over several weeks or becomes more noticeable, it is important to seek medical evaluation. And as the condition progresses, discomfort in the upper abdomen may begin to reveal another important warning sign. Sign number 4, upper abdominal pain or discomfort. Another symptom that may develop is a persistent discomfort in the upper right side of the abdomen. This pain is often described as a dull ache that feels deep and difficult to clearly locate. In some cases, the discomfort may gradually spread toward the back or even the right shoulder. This occurs because a growing tumor in the liver can press against nearby tissues and nerve pathways. Many people notice that the pain becomes more noticeable after eating or during periods of rest. At first, it is often mistaken for common digestive issues such as indigestion or stomach discomfort. However, unlike typical stomach pain, this sensation may gradually increase in frequency and intensity over time. As it progresses, the discomfort can begin to interfere with sleep, movement, and daily activities, and as pressure builds within the abdomen, another visible and concerning symptom may begin to appear. Sign number 5. Swelling in the abdomen, also known as ascites. Another noticeable change can be an unusual swelling or enlargement of the abdomen that develops over time. This swelling may create a feeling of tightness or heaviness, even without significant changes in eating habits. It often occurs because fluid begins to accumulate inside the abdominal cavity, a condition known as ascites. This happens when the liver is no longer able to properly regulate and process fluids within the body. As pressure builds, many people describe a constant sensation of fullness or stretching in the stomach area. At first, this change is often mistaken for simple weight gain or bloating caused by diet or lifestyle. However, unlike normal bloating, the swelling does not improve with dietary changes or reduced food intake. When abdominal swelling continues to increase or feels unusually firm, it becomes an important sign to evaluate. And as these internal imbalances continue, visible changes in the skin and eyes may begin to emerge. Sign number 6. Yellowing of the skin and eyes, also known as jaundice. One of the more visible signs of liver problems is a yellowish tint that appears in the skin and the whites of the eyes. At the same time, many people notice that their urine becomes darker, often resembling tea or cola in color. Stool color may also change, appearing pale, clay-colored, or lighter than usual over time. These changes occur because a substance called bilirubin begins to build up in the bloodstream. Under normal conditions, the liver processes bilirubin and helps remove it from the body through bile. However, when the liver is damaged or bile flow becomes blocked, bilirubin cannot be cleared efficiently. Although jaundice is easier to recognize than other symptoms, it often appears in more advanced stages of disease. For this reason, it is considered a strong warning sign that requires immediate medical attention. And beyond these visible changes, the digestive system itself may begin to show further signs of distress. Sign number 7. Nausea and vomiting. Another symptom that may gradually appear is a persistent feeling of nausea that does not have a clear cause. You may feel uneasy in the stomach throughout the day, even without eating anything unusual or unfamiliar. In some cases, this nausea can progress to episodes of vomiting that seem to come and go unpredictably. This happens because the liver plays an essential role in supporting digestion and maintaining internal balance. When liver function declines, toxins can build up in the body and begin to disrupt the digestive system. Many people describe a constant sensation of discomfort, as if their stomach is never fully settled. At first, these symptoms are often mistaken for food poisoning, acid reflux, or common stomach issues. However, when nausea persists and does not improve with time or simple remedies, it becomes a concerning signal. And as the body continues to struggle internally, changes in blood clotting may begin to reveal the next warning sign. Sign number 8. Easy bruising or bleeding. Another important warning sign of liver cancer involves changes in how easily your body bruises or bleeds. You may notice bruises appearing on your skin without any clear injury or physical impact. Even small cuts or minor wounds may take longer than usual to stop bleeding. This occurs because the liver is responsible for producing proteins that help the blood clot properly. When liver function declines, the body cannot produce enough of these clotting factors, making bleeding harder to control. Some individuals describe frequent nosebleeds, bleeding gums, or unexplained marks on their arms and legs. At first, these signs are often dismissed as minor accidents or simple clumsiness in daily life. However, when bruising or bleeding begins to happen more frequently, it may signal a serious underlying condition. And once these warning signs are recognized, many people begin to ask an important question about how to protect their liver moving forward. Now that we have explored these warning signs, an important question naturally follows. How can you protect your liver and reduce your risk of liver cancer? Here are 5 important steps that doctors often recommend to support long-term liver health. First, maintaining a healthy weight plays a critical role in protecting the liver from chronic inflammation and fatty liver disease. Excess body fat, especially around the abdomen, can gradually damage liver cells and increase the risk of cancer over time. Second, limiting alcohol intake is essential, as excessive alcohol consumption is one of the leading causes of liver damage worldwide. Even moderate drinking over long periods can place stress on the liver and lead to serious complications. Third, protecting yourself from hepatitis infections is extremely important, particularly hepatitis B and hepatitis C. Vaccination, safe medical practices, and avoiding exposure to contaminated blood can significantly reduce this risk. Fourth, following a balanced diet rich in vegetables, fruits, and whole foods helps support the liver's natural detoxification processes. Reducing processed foods, added sugars, and unhealthy fats can lower the burden placed on this vital organ. Fifth, regular medical checkups can help detect liver problems early, even before symptoms begin to appear. Routine screenings and blood tests allow doctors to monitor liver function and identify potential issues in their earliest stages. By taking these simple but powerful steps, you can actively support your liver and reduce the risk of serious disease. And when prevention becomes part of your daily lifestyle, your chances of maintaining long-term health increase significantly. As we come to the end of this video, it is important to remember that your body often speaks long before a disease is diagnosed. The challenge is that these signals are usually quiet, subtle, and easy to ignore in everyday life. Fatigue, appetite changes, or mild discomfort may not seem serious at first, but they can carry deeper meaning. Liver cancer, like many serious conditions, is far more manageable when detected early. That is why paying attention to persistent changes in your body can make a life-changing difference. Taking action early, seeking medical advice, and prioritizing your health can significantly improve long-term outcomes. If you have noticed any of these symptoms in yourself or someone close to you, do not ignore them. I would love to hear from you. Have you experienced any of these signs? Or did something in this video surprise you? Share it in the comments below. If you found this video helpful, consider subscribing to the channel for more science-based health insights that could protect you and your loved ones. And if you believe this information could help someone else, please share this video so more people can recognize these warning signs before it is too late.